In this presentation, we will explore the remaining joints of the cervical region and its associated musculature, together with the scapula. In the neck, there are 8 segments between the occiput and the cervicothoracic joint, these being the vertebrae and these being the soft tissue segments. There are 7 vertebrae in total, and we looked at the atlas and axis joints in the previous presentation. The remaining 5 cervical vertebrae are virtually identical boxy structures overlying each other in a horizontal arrangement, and plate-like facet joints, which are much more substantial than the underlying transverse processes. They're supported by the lamellar strands of the nuchal ligament. The dorsal spinous processes are all but absent, and each one has 6 separate joints that can potentially become uncomfortably asymmetrical and dysfunctional. So there are 2 facet joints here and here, an intervertebral ball and socket joint here, and this is cranial, this is caudal. Cranial fitting on top of the caudal vertebra, and they easily laterally flex. Range of motion progressively increases towards C7, then is very limited at the cervicothoracic joint. There is a common trigger point in the region of C5 within the brachiocephalicus muscle, and the image shows the region where it can be palpated. And if you recall in the last presentation, the video I showed you at the end, trigger points are hypersensitive, localized, focused points within a muscle that cause fasciculation and acute pain on palpation. And it's as if they are congested and hypersensitive and hyperreactive and just somewhat muddled in their function. I'll show you some film of that shortly. This muscle is a highly dynamic muscle involved in all phases of the stride, in stance when the hoof makes ground contact, swing as it passes over the ground, and suspension when the body is in mid-air and there is no support from any other limb making ground contact. Action of the cervical joints and muscles are elevation, lateral flexion and rotation, although this is minimal because of how the interlocking plate joints perform. A neck extension is brought about passively by gravity and by relaxation of the flexors and elongation of the nuchal ligament. The cervicothoracic joint is flexible through the articulation with the suspended neck, but abruptly fixed through the thorax, as you can see in this image. See how much the thoracic vertebrae are fixed by the ribs and enclosed by the scapulae. Let's look at the muscles with cervical insertion, and recall that muscles in red are extensors, although in this instance they will be elevators in their role. Green are flexors, and yellow have dual roles or some other function that is not flexion or extension. Also recall that these diagrams are an aid to learning muscle origins and insertions, and as such they're not entirely precise as they appear in the body. Homo transversarius inserts into the axis, and the third, fourth and fifth cervical vertebrae, with origins much the same as brachiocephalicus, which it works alongside with. It's an interesting muscle to look at when dissected, as it has a substantial and distinct branch with each of the vertebrae that it is directly connected to. Where brachiocephalicus has its insertion into the skull, this muscle firmly stabilizes the proximal vertebrae, or those closer to the body, while the thoracic limbs are in motion and while at the same time assisting with operating the limbs. This is the muscle which will become overdeveloped in horses with an inverted top line, and it looks very bulky there with limited top line development. Splenius cervicis, and recall that it has a separate portion which attaches to the atlas called splenius atlantis. It has its origins on the nuchal ligament in the wither region and insertions on the third, fourth and fifth cervical vertebrae. It acts to moderate or buffer or slow or even coordinate head movement when the body is in motion and the neck, which is suspended in mid-air, requires stabilization. Serratus cervicis has a corresponding thoracic portion and is an important postural muscle which can elevate the base of the neck, as you would see in collection, but think of it as a working group of four muscles lifting the forehand. So here, here, and on the other side, the other pair. Longus colli is one structure, unlike most muscles which are represented in the body as pairs. It doesn't get too much of a mention in the textbooks, but it looks to be a very important muscle in equitation, with its origins in the ventral cranial thoracic vertebrae and insertions in the neck all the way up to C3. It supports the cervicothoracic region and ventrally flexes the neck. So this is very much another important muscle involved with collection if the horse can coordinate it with the serratus ventralis and cervicis muscle group, which we just considered. And by now you will be appreciating how challenging it is for the horse to perform this coordination with a rider on its back. Longissimus cervicis continues spinal support of the neck, and with longissimus capitis and atlantis, which we looked at in the previous presentation. Origins are in the wither region vertebrae and insertions up as far as C4. It flexes the neck laterally, and bilaterally it supports and elevates the base of the neck. Spinalis cervicis is the third element of the spinalis muscle, another neck support and elevator muscle which can also flex when operating singly. Origins are the thoracic vertebrae as far as the thoracolumbar joint, and insertions are as far as C3, and it's not difficult to see how functioning of this muscle would be impacted upon by an ill-fitting saddle or an unbalanced or unskilled rider. See how many muscles support the base of the neck and how important the cervicothoracic joint is. Also how many muscles there are to be conditioned for neck support and optimal muscle balance there. It makes no sense to fix the horse's head when these muscles are being developed, because without movement there can be no development. Riders can become fixated with neck shapes, but without these muscles being coordinated, then correctly, progressively developed in movement, or educated in other words, riders are fooling themselves into thinking that their horses' heads are being correctly biomechanically supported when they are in training. The spinal stabilizers begin at C3 with multifidus and connects the transverse processes and has three elements: lateral, medial and deep. Deep crossing one pair of facet joints laterally, medial crossing 3 joints, and lateral crossing 4 joints. And they cross single elements incrementally so that a segmental overlapping occurs. So in other words, these will appear here and here and here. These, as well as here, they will start on the next vertebra along to here, and these the same on the next vertebra onto here. So you can see a substantial lacing of the cervical vertebrae with multifidus for stabilization. Intertransversarius has 2 rows of muscles connecting transverse processes to adjacent facet joints and transverse processes to adjacent transverse processes. And they stabilize the vertebrae but can also rotate slightly. Spinal stabilizers are postural, not locomotor, and that can mean that they are readily strained, causing back pain if subjected to overuse injury or sustained postural asymmetry or loading. So for example, flexion, then rotation will strain and injure the postural muscles. They're frequently seen to take on a dysfunctional role even in highly trained, skilled athletes. Therefore, there is a case to be made for cross-training and not just doing repetitive competition movement. The whole body needs to be trained in order for the posture to be strong and secure. It is thus supported and protected by correctly functioning locomotor muscles, the bigger muscles. Pilates style conditioning is ideal because movement is slow and dynamic strengthening moves are carried out, with focus on proprioceptive activities for development of neuromuscular coordination of muscle contractions. For this reason, turnout has to be neuromuscularly more beneficial than stabling a horse for long periods, especially if the horse is typically mostly looking one way, or if their hay net is positioned so that they have access to it mainly in one direction. So thousands of repetitive movement extracting hay from its net. So at least they should be fed from the ground when they're in the stable. Let's take a look at the neck muscles at work and observe the benefits on the muscles of working a horse slowly so as to allow the horse time to recruit all those individual muscles. Equitation trainers are Hannah Walton and Jean-Luc Cornille.
So I'm putting light pressure here. Often horses find this really hard because they're stuck and they're braced a lot of the time. So to ask him to lower his head without stepping forward is actually a really good way of helping him to release all of this and release through his back.
And we'll recruit different muscles.
It's quite normal that he would want to take a step, but what I'd love him to do is be able to do one, halt, and put his head down without taking a step forward. Good boy. I don't want him to go in there, into his chest. I want him to find out. And as the horses get used to doing this, you can really help them by suggesting out slightly, so you get releases from all of the underneath of the neck like this. So even just something as simple as that, I get all my students to start with something like that. Just helps the horse in so many different ways. And if they see their horses up and high, if they can just ask them to lower their head and get those endorphins released, then they're in a better place.
So lots of variation of movement and muscle contraction activity there and relaxation.
So I adjust the lunge on the tap. I change the length of the lunge. So then
here you can see a lot of muscle recruitment, contraction, relaxation, flexing, definition of the muscles at work, good splenius there, coordination, and it's very slow. The horse is not restrained.
Therefore, he does all this thing where he tries to overbend the neck because it's too much contact on the beat. So I change the lunge a lot to stay in control of him, but don't enter the dispute of the beat.
Just light, consistent communication and encouraging the horse to work slowly, recruit slowly and efficiently through the neck musculature. The scapula protracts and retracts the limb. Muscle contour of this region changes with exercise. That's during exercise, not just over time. And this has implications for saddle fit. The dorsal scapula in the region of the scapular cartilage abducts and adducts in motion. That cartilage is flexible and readily injured by saddle tree points. This is the right scapula, and you'll note the contours against the rib cage. It's slightly curved, so when it rotates backwards and forwards, it does so in adduction and abduction. And I'll show you that in a film shortly. Saddle positioning can readily cause interference with the thoracic limb motion. They're sized by tree point angle and width. So angle and width. And must be fitted well, particularly with muscle action in mind, in that functioning muscles infused with blood circulation require the physiological space to do so. Therefore, flocking needs to accommodate this. You can see in this image the tree points are far too close to the musculature and will make contact as this horse moves and rotates the scapulae. Saddles have repetitive contact with the underlying structures, so this will happen many, perhaps thousands of times when the horse is ridden. And the scapulae are most at risk from the rigid tree points at the front. There are two main fitting protocols for English saddles. The traditional method of fitting the saddle so that the tree points remain clear of rotating scapulae So just note that this limb is flexed, the rotation of the scapula, not quite maximal because you have to make allowances for show jumpers and those who have even greater range of motion, including the dressage horses. But the first method of fitting English saddles is to make sure that the saddle tree points are well clear of the scapulae, and this means that they're set back in position so that when the scapula or the foot is on the ground, the scapula will rotate forward more. So we would need 2, 3, 4 fingers width in this region for the points to sit behind. In the second example, the rotating scapulae will pass under the front of the saddle. The flocking would protect the scapula from the tree points, and tree points tend to be longer in this saddle design. Both require equally careful placement to ensure that they are fitted as the manufacturer intended, or the scapula would become injured. Neck muscles with scapular attachment are serratus ventralis, which is paired with its cervicis portion, which we saw a short time ago, and it has origins on the medial side of the scapula. So this is the rib cage side, and these are the attachments of serratus ventralis and cervicis, and insertions into the first 8 or 9 ribs. It suspends the chest against the thoracic limbs. The rib cage will lift with its attachment to the scapula to form the dorsal or the upper structure of the thoracic sling muscles. Think about the part it plays in jumping and the fact that it's actually much easier for the horse to take off over a jump than to brace for the landing, and all the weight that is then transferred into the thoracic limb, the whole weight of the hind quarters. There are 2 parts to the rhomboideus, but I've shown them here as one. The thoracic element draws the scapula upwards, and the cervical element elevates the neck and head. Again, saddle tree points are a restriction risk here. And the saddle design where the scapulae are designed to pass under the tree points are usually flared out at the front, so largely avoiding contact with this portion of the rhomboideus. The trapezius muscle also has 2 elements. Cervicis protracts the limb, and thoracis retracts it. Let's look at a short film of the scapula and related neck musculature in action, and keep thinking about saddle fit as you watch. See how much reach there is and the rotation of the scapula. How much muscle action there is. How much connection to the hind end of the horse. And the abduction and adduction of the scapulae. Abduction, as this one adducts. There's adduction here. How much rotation, how much movement of the head and neck, rotation in the spine, And all this is brought about by the thoracic limbs and an unrestricted scapulae. You see the reach here and how there's protraction and retraction of both limbs at the same time. See how much flexion there is, how much activity, how much the thorax rises and falls here. So the saddle has a tough job to do here. There are several tests for the neck and scapulae. The first is to check the underside of the neck for ventral symmetry, and the vertebrae will show a protrusion of misalignments or an imbalance in muscle development there. Then slowly take the base of the neck through passive flexion. I have a film of that to show you shortly. Baited stretching, in my opinion, has limited value beyond assessing the gross movement that the horse attempts to avoid, and most horses will turn their hind end to cheat for the treat. Look for atrophy in all regions of the neck, and particularly in the serratus cervicis area, just in front of the scapulae. And an absence of development there could indicate an unwillingness for the horse to lift or elevate its neck, for example. And try to relate the atrophy to the dysfunction of the movement involved to develop that muscle. So, for example, a horse with hind limb joint issues will be less able to push from the hind end, from those joints, because it would be painful, and transfer that movement into and over the spine and into the neck region. Therefore it won't lift, therefore there will be atrophy in the neck elevators. Palpate brachiocephalicus muscle for trigger points in the region of C5, and I'll be showing you that in a film. Stand the horse square on a flat surface and compare the positions of the points of the shoulder, noting which is higher or lower. Again, look for atrophy, especially in the saddle tree point region, and where saddle and rider compression could be an issue. Check feet for high heel, low heel syndrome, identified by Dr. Kerry Ridgway, whereby hoof symmetry can impact on shoulder muscle symmetry. The low heel can develop with habitual protraction, and the high heel with retraction. Because this limb is loaded, this limb is unloaded. Loading of the foot will make this heel appear higher than this one. The protracted limb has more scapular rotation, and this correlates with greater protrusion on the scapula on the same limb, again impacting on saddle fit if it remains unresolved. Ground schooling can work very well for these cases if enough time is allowed for the resolution. Let's take a look at lateral flexion and locating the trigger point in a short film. So just bring the head slowly towards the hind end, assessing for any restriction. This is not forced, this is just an evaluation of how far the horse is willing to flex. And the trigger point on brachiocephalicus in the region of C5. You can see how much fasciculation, muscle reactivity. There, muscle tremors. And much of this is due to hay net use. Finally, with regard to the rider that is stacked over the horse's back, the shoulder girdle aids head and neck support. And it can impact on the positioning of the pelvis in the saddle. So a rider crooked or weak through the shoulder girdle will alter their position of their pelvis in the saddle, perhaps with too much rotation, for example, on one side compared with the other. Sternocleidomastoid, that's the blue muscle here, originates in the sternum and inserts in the occiput, and as you can see, it's involved in neck rotation. To position, rotate and stabilize the head. Trapezius extends the neck and assists with arm position. So this is the green muscle, neck extension, and because it has insertions in the upper arm, it can position them, stabilizing the arms as they hold the reins. Rhomboideus controls the rider's upper body posture by positioning the scapulae. So origins on the vertebrae, insertions into the scapulae, and they lace the scapulae and draw the shoulders back. Riders are very much at the mercy of their environment. Asymmetrical yard duties of mucking out, sweeping, carrying water buckets, and with that level of muscular conditioning, such riders can rarely sit straight on a horse without regular body work and having this problem regularly addressed. Their beds, and especially the pillows, will affect their posture in the neck region. Sofas, how many do you see with no neck support? That support finishing just below the shoulders, so encouraging muscle imbalance and not giving the head and neck muscles a chance to truly relax. Car driving position with fixed outstretched arms and repetitive operation of the clutch pedal. So in a manual gear shift car, that will negatively impact on posture. So if you drive to the yard, think about perhaps you would be warming up your hip joint in clockwise rotation, and then when you sit in the saddle, you could still be fixed in that position. Studying, you can spot a student at 100 paces with their protracted shoulder girdles. And the ubiquitous smartphone, again, a pronounced but prolonged neck flexion. And this is of particular concern in young people whose immature postures are still under construction. In the next presentation, we will look at muscles in the back region.